Welcome everyone to the Ontario Caregiver Organization's webinar series. These webinars bring together caregivers and subject matter experts to explore topics of interest to caregivers. We do this to support and engage chosen family, friends, and neighbors who are caring for someone. I'm Anne-Marie Boutiette, and I will be your moderator for today. Before we begin, I'd like to take a moment to acknowledge the lands that we're on today. While we meet on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we each call home. I'm joining you from the town of Cobourg in Northumberland County, which is the traditional territory of the Mississauga, Anishinaabe, Wendat, Neo-Wentzio, and Haudenosaunee peoples. This territory is covered by the Johnson-Butler Purchase from 1788 and later confirmed in the Williams Treaty of 1923. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging this reminds us that our great standard of living is directly related to the resources and friendship of Indigenous people. If you'd like to learn more about the lands that you're joining from today, you can click on native-land.ca. It's in the chat there, and find out where you are located on the map. So at this time, I will ask audience members to make note that you can write your questions in the chat since your microphones are off, and we will be answering them at the end of today's presentation. So our webinar today is called High Quality Care for Osteoarthritis of the Knee, Hip, Hand, or Shoulder. As a caregiver, you may be caring for someone with osteoarthritis, or you may have been personally diagnosed with the condition. In either case, it's important to understand the kind of care that you can expect from your clinicians. Quality standards are essential for both patients and caregivers to know what to anticipate in their care. In this webinar, the OCO welcomes back Ontario Health to discuss the updated quality standard for osteoarthritis of the knee, hip, hand, or shoulder, providing you with valuable information, tools, and resources. So today we'll learn about Ontario Health's updated osteoarthritis care for adults with osteoarthritis of the knee, hip, hand, or shoulder quality standard and patient guide, about key quality statements that can enhance care for people with osteoarthritis and their caregivers in the community, programs, tools, and resources for caregivers to support people with osteoarthritis, as well as caregiver resources presented by Arthritis Society Canada, along with other caregivers' experiences. So I would like to introduce you to our panel for today. Our caregivers are Ash Salia and Kathleen Conybeare. Ash is a 37-year-old based in Toronto. She's a public safety professional and a volunteer, and is in the process of transitioning into social work. After being diagnosed with a form of osteoarthritis in her knees, Ash has been focused on caring for her health, staying active, and building strength, physically, emotionally, and spiritually. These days, she's prioritizing her well-being, spending time with family, and embracing the simple joys that bring her peace. Ash loves cooking, pottery, swimming, being in nature, and hitting the road for spontaneous trips whenever she can. Kathleen lives in Ottawa with her wife of over 30 years and their cat. She was diagnosed with osteoarthritis in the knees in her 50s. Having an interest in improving healthcare, particularly for marginalized people, she volunteers with several organizations. She's currently a member of the OHT, the Ontario Health Team Client Partner Table, as well as the Patient Navigation Subcommittee and Mental Health and Substance Use Working Group. She was also part of the advisory committee of OCO called Sharing for Change, which was a Caregiver Stories project. Additionally, she's a peer mentor and facilitator for OCO. Kathleen is also a facilitator for the 50+ Silver Souls, peer support group for Kind Space, and LGBTQ2S1 Community Community Center. Recently, she participated in the Elder Queer Storytellers performance hosted by the National Arts Centre. In the past, she's facilitated for Psychiatric Survivors of Ottawa, Mood Disorders Ottawa, and Writers Collective Canada. And our presenters today are Carol Kennedy and Carolyn Gord, PhD. Carol has a clinical background in physiotherapy and is a lead in the Clinical and Quality Standards program at Ontario Health. In this role, she led development of the osteoarthritis quality standard in collaboration with an advisory committee, including people with lived experience, clinicians, researchers, and administrators. Carolyn is the Director, Knowledge Translation and Exchange at Arthritis Society Canada, where she leads the production of resources to share the impact of the organization's mission work, including research, advocacy, information, support, and innovation programs. She also oversees patient and public education initiatives to empower people living with or at risk of arthritis to better understand and manage their disease and lifestyle. Carolyn's professional background spans biomedical research, scientific and medical communication, learning and development, and knowledge translation in academic, private, and nonprofit sectors. She's committed to making research evidence accessible and useful for a variety of audiences. So, speaking from their perspectives, we welcome Ash and Kathleen to share their caregiving experiences. And we welcome Ash to start. Take it away, Ash.
Thank you so much, Anne-Marie. Hi, everyone. My name is Ash. Pleasure to be with you all today. I'll get right into it. I am 37 years old. I live in Toronto. I have many hobbies, including being in nature, pottery, cooking. And while osteoarthritis is commonly associated with aging, my experience began much earlier. My OA developed as a result of some car accidents over the years that impacted my knees and actually affects my lower back as well. OA has significantly affected both my personal and my social life. Some days I experience stiffness, shooting spasms, pain so intense that my knees and back become unstable. And because of this, I'm limited in how long I can stand, walk, dance, hike, go up and down a flight of stairs, and do activities I once deeply enjoyed. And to manage my symptoms and my flare-ups, I rely on a range of tools and modalities, including braces, walking poles, laser therapy, acupuncture, natural supplements, strength training, as I really enjoy going to the gym, and somatic practices as well, which are more holistic, such as breath work and meditation. I want to say that my path to diagnosis was long and frustrating. Some practitioners minimized my symptoms or offered very narrow solutions, often prescribing pain medication without considering my broader health needs. And the therapeutic exercise programs that I received were usually very generic and didn't account for my physical limitations nor my goals. And as an active person, I was really surprised that no one discussed how I could safely continue going to the gym while supporting my osteoarthritis condition. And so this gap in care really forced me to find my own way. I was blessed that I eventually reconnected with a chiropractor I had known years ago, someone who truly listened and understood the complexities of managing osteoarthritis. They introduced a personal trainer in their clinic that had experience working with individuals with osteoarthritis, and this made a significant difference. Alongside this, my own research and support from my naturopathic doctor helped me access the patient education I had been missing. I learned how nutrition and supplements and personalized physical activity could support my overall healing. And this integrated and informed approach really empowered me to make better decisions and advocate for my health with confidence. Now, how it's affected my caregiving. I am a caregiver to my beautiful grandparents. I am one of their primary caregivers. My grandmother requires transportation to medical appointments. Meanwhile, my grandfather is experiencing cognitive decline, which impacts his ability to manage daily tasks. And both of them, they spend so much time of their time at home. And so they rely on me not only for practical support, but also for social connection and emotional companionship. However, because my osteoarthritis symptoms can fluctuate unpredictably, there are times when the flare-ups in my knees do prevent me from visiting them or driving. And these episodes can also impact my mood. So I often rely on my mother. She's also another caregiver to my grandparents for emotional support. And I draw from her own lived experience. And one thing that I've experienced also with my grandparents is sometimes they hesitate to ask for help because they're uncertain how I will be feeling on any given day. And although this is unintentional, they're coming from a very caring place. It can leave me feeling a bit undervalued, a bit incapable. It reminds me that my independence has is not where I'd like it to be. I've gently encouraged them to let me decide whether I'm able to assist them rather than assume I cannot, so I can exercise my own autonomy. And, even on days when my physical limitations are present, I still remain committed to staying connected and involved in their lives, supporting them any way I can, even if it's just with a phone call, for an hour, if I can't see them because I have some flare-ups in my knees. So in sharing this with all of you, living with osteoarthritis at a younger age has challenged my physical capacity, my mental health, my sense of identity, and also how I show up or how I want to show up for my grandparents. Still, I do my best to maintain a positive outlook and to stay engaged in the things that matter most to me. My experience overall has shown me how essential it really is for healthcare providers to consider all aspects of a person's overall health and to provide personalized patient education and medical care that truly supports an individual's needs. So, those living with OA can feel more informed, supported, and empowered to live their full lives. So that is me, and I thank you for listening, and thank you again for having me.
Thank you so much, Ash, for sharing your story. I really like how you highlight that communication is really important, right? With the care recipients that you are supporting to make sure that you're heard and that you guys can kind of meet in the middle. Thank you. And now we're going to turn it over to Kathleen.
Hello, everybody. So I'm coming from Ottawa, although I used to live in the country. And when I moved from the country to the city, I didn't really seek a doctor right away. I went looking for one when I started to be in pain. I sought someone local because I didn't relish the idea of taking one or two or who knows how many buses these days to get to a doctor when I wasn't feeling well. I'd been a flyer carrier for 3 years. I delivered over 800 flyers over 9 hours in all weather from minus 30 degrees to 40 plus degrees every season, every weekend, up and down the stairs, up and down the hills, up and down the steep driveways, in the ice and in the wharfs and in the snow. And my knees were starting to get more and more painful and would sometimes collapse from under me when I was on the stairs, which I found a little bit nervous making. So when that started to happen, I went to the doctor, some over 10 years ago when I did this. And I was diagnosed with osteoarthritis in my knees, pre-diabetes, and also referred to a psychiatrist for depression. That was all that was offered me at the time. There were no meds, there was no care plan, no educational materials, no goal-oriented self-management plan. There was nothing but hang in there until you're 60 because these knee replacements are only good for 20 years. So for 10 years, I tried to manage my pain on my own, and I did more or less successfully. In the early days, I used to need a cane to get around all the time, but with the help of nutritional and herbal therapies, I was able to improve my mobility significantly. So now I mostly don't need a cane anymore, except in when I've overdone it a bit in the exercise department, or if if the weather changes, that will affect me also. One of the things that's mentioned in the standards of care is the importance of getting exercise. My doctor didn't suggest any exercise for me, and also I had to find out for myself that when I exercise, it's sometimes, even when I'm trying to be careful, I don't really believe in no pain, no gain. So when I started to hurt, then I would stop. But even then, sometimes it was too late. And if I wasn't careful, I could be laid up for several days. And so that urgent recommendation that people exercise needs to be fleshed out a bit so that it's actually practical. The other problem I've had is that all of these conditions, they all worsen each other, and I haven't really had any, although we're looking at the osteoarthritis condition, particularly, they all worsen each other, and in my experience, there's not much recognition of that kind of interaction and how to accommodate a person's needs and pain levels and stiffness in a holistic manner. When I went to my GP, I was quite fit and not as heavy as I am now. However, as subsequent visits to the doctor, I wasn't offered any weight management information. I wasn't offered any meds, so there was no pharmacological symptoms to manage. I wasn't referred to any clinicians, and as mentioned before, I was wasn't referred to consideration for surgery because I was told I was too young. I managed my pre-diabetes, depression, arthritis, and by informing myself about nutrition and herbalism. My pain levels are much better now compared to what they were, but I still have difficulty with the stiffness. And the stiffness is very problematic because it makes me unstable, so I always feel like I'm going to fall. I used to love to hike, and I can't do that very well now because I worry about falling and not being able to get up. I have trouble with the stairs. I have trouble getting on and off buses. I have trouble sitting in the buses because then you have to stay in the same position. Sometimes there's not enough leg room. There's not enough ability to stretch. And this is especially difficult because I caregive for my wife, and my wife has mental health challenges which require hospitalization at times. And if I want to go and see her or bring her toiletries or anything like that, I have to go on the bus. It takes over an hour and a half to get to any hospital from my home here in Ottawa. And so it becomes quite an ordeal to go and see her, 3 hours on the bus, and it's exhausting and painful. And it's a big problem for me when she's in the hospital. It was particularly difficult during COVID because sometimes I was refused entry onto the bus at all because they could see that I had a cane, and they wanted me to get on the bus at the front of the bus. I mean, at the back of the bus during COVID times because they were worried about contamination, and I couldn't get on at the back of the bus, and so sometimes the bus would drive right past me. But as I said, things are getting better. But so now, even though things have improved, my wife is well at the moment, and she's the one who does all the errand running around the house for the household, and because I have trouble with the stairs and the buses and etc. And she can still get around. But it is worrisome to me because she has mental health challenges that if she is overstressed because she's running all these errands and trying to have a life in addition to helping with the household, it could ultimately lead to another mental health challenge. And she's been psychotic as a result of extreme stress at times. So that's worrisome. I would have liked to have some standards of care offered me upon diagnosis because then I would have known what to expect and what to advocate for if necessary. The lack of any additional medical support or follow-up, sorry, can't read my own writing, has impacted on me. I, for a long time, felt helpless and hopeless. Trigger warning, I've been suicidal at times because of a sense of isolation and powerlessness, especially when I couldn't get around. And of course, not maintaining my own health and especially my mental health is absolutely vital to the quality care that I have to offer for my wife. And when necessary, and it has been necessary at times, when I need to advocate for her when she is in crisis herself in the hospital. So thanks for listening. I hope this has given you some insight into some of the struggles that we have.
Thank you so much, Kathleen, for sharing and for being so vulnerable. Always appreciated when we hear directly from caregivers so that people don't feel so isolated. And so I appreciate the insight that you gave us today. All right, so now we're going to pass things over to Carol from Ontario Health, who will walk us through the osteoarthritis data for Ontario.
Thank you, Anne Marie. So let's get started by reviewing the data on osteoarthritis in Ontario. Osteoarthritis is it's a very common condition. Approximately 14% of people aged 20 and over are currently living with osteoarthritis, and this percentage increases as people age. 41% of women over 65 have osteoarthritis. People with osteoarthritis often experience movement-related joint pain, aching, stiffness, and swelling of the joints. The joint pain in particular can have a negative impact on people's quality of life due to weakness, reduced mobility, and functional movement, which can in turn make it harder for people to take part in meaningful activities or do their job, and it can increase a person's social isolation, which we've heard about today and with the lived experience stories. Often people who have osteoarthritis also have other health conditions as well. Joint pain can cause people to move less, which can make them more at risk for cardiovascular, muscular, and metabolic conditions. For example, the risk of type 2 diabetes in people with osteoarthritis is 40% higher than for people who don't have osteoarthritis. Joint pain can also lead to mental health problems that may make osteoarthritis worse, such as pain, poor sleep, and depressed mood. This diagram shows how pain from osteoarthritis can lead to even more pain. When osteoarthritis is poorly managed, people avoid physical activity, which leads to more pain. This in turn can lead to troubled sleep, fatigue, disability, impaired activities of daily living and at work, and depressed mood, and is linked with heart disease, diabetes, and obesity. The next slide shows the different lines of treatment for osteoarthritis. At the bottom is the first line, which says that all people with osteoarthritis should receive education on self-management, exercise, and weight management. The next level, second level, shows that some people with osteoarthritis that's more severe might consider medications like Advil or Tylenol or cortisone shots. And people with the most severe osteoarthritis should receive third-line treatments. So referrals for consideration of surgery for joint replacement. It's important that people with osteoarthritis receive the right type of care based on how severe their osteoarthritis is. So next, to help people with osteoarthritis and healthcare clinicians who care for them know what kind of care is appropriate, Ontario Health developed the Osteoarthritis Quality Standard. If you've never heard about the quality standards at Ontario Health, they are a small set of statements that describe what best care is for a given health condition or process of care. For example, we have quality standards on diabetes, schizophrenia, and transitions between hospital and home. And we've now developed over 40 quality standards to date. The quality standards focus on topics where Ontario data shows that patients receive very different care depending on where they live in Ontario, or where there are gaps between the care provided and the care that patients should receive. Quality standards are grounded in the best available evidence using clinical practice guidelines, as well as clinical expertise and lived experience of advisory committee members. In short, they set a standard for how care should be delivered, no matter who provides the care or where they live in Ontario. So the Osteoarthritis Quality Standard talks about assessment, diagnosis, and management of osteoarthritis for people aged 18 years and older who have osteoarthritis of the knee, hip, hand, or shoulder. It talks about how to manage osteoarthritis using medicine, through other approaches like exercise and lifestyle changes, and when their clinician should think about referring them for surgery. This quality standard doesn't apply to people who have osteoarthritis in other parts of the body, or people who have other types of arthritis, like rheumatoid arthritis. So on the next slide, you'll see the Osteoarthritis Quality Standard covers 10 important opportunities to improve care. In the interest of time, we're going to focus our conversation today on quality statements 3 through 8, and these are the topic areas that are bolded on this slide. These are areas where patients and caregivers can play an important role in their own care. So in the interest of time, I won't reread all of those. We'll be going through the bolded statements there. So let's take a closer look at these statements. So quality statement 3, patient education, reads, people with osteoarthritis are offered education to facilitate a self-management plan. This education is provided in accessible formats. And then within this quality standard, we define what this would mean for a clinician. So your healthcare clinician, such as your family doctor or your nurse practitioner, should help you learn about osteoarthritis, what you can do to manage it. If your care recipient is the one with osteoarthritis, it will still be helpful for you to receive this education so you know best how to help them. The clinician should provide you with this information or refer you to an education program in your community. And here are some key things that everyone with osteoarthritis or anyone caring for someone with osteoarthritis needs to know. The importance of being physically active, doing specific exercises, and managing your weight. These things can help reduce your pain, improve other symptoms such as poor sleep and mood changes, and maintain your ability to function. Also, you should be shown how to protect your joints and prevent injury while being physically active. For example, taking short breaks to allow your joints to rest. This slide shows our patient guide, but what if your healthcare clinician or your care recipient's healthcare clinician hasn't given you this education, or there are no programs in your community? This is where we want to highlight the patient guide that accompanies the osteoarthritis quality standard. Our team is going to put the link to it in the chat right now so you can access it. At the end of this patient guide, you will see a page titled Learn More, with patient education resources from well-known arthritis advocacy groups, such as the Arthritis Society, the Canadian Arthritis Patient Alliance, and GLAD Canada. These sites have wonderful resources for people with osteoarthritis and their care partners on various aspects of living with osteoarthritis, and we'll highlight some of these resources as we go along today. And just to note, as Carolyn Gord will be walking us through the Arthritis Society's website shortly, I won't be touching on those ones during my presentation, and Carolyn will be sharing those in more detail later on. So starting with GLAD Canada, GLAD stands for Good Life with Osteoarthritis in Denmark, because that's where the program was started. And then GLAD Canada was was brought and implemented to Canada. And it's a program for people with osteoarthritis of the hip and knee. On their website, you can find many educational resources to learn more about osteoarthritis. You can explore the different tabs with information on osteoarthritis, or you can register for a virtual education session under the Participants tab. So moving along, the next statement is on having a self-management plan. And the quality statement reads, people with osteoarthritis are supported to develop an individualized, goal-oriented self-management plan that evolves to address ongoing symptom management and access to resources and supports. So what does this mean for you and your care recipient? Your clinician should work with the person with osteoarthritis to create a self-management plan so that you understand your own role in managing your osteoarthritis, or in helping your care recipient manage theirs. The plan should include information about how to access local services such as exercise classes, weight management programs, and support groups. And the plan should consider any other medical conditions you have. The plan might also include information about devices and aids such as suitable shoes, leg braces, orthotics, and hand grips. The next quality statement 5 is on therapeutic exercise, and it reads, people with osteoarthritis are strongly encouraged to participate in progressive neuromuscular training, muscle strengthening, and aerobic exercise of sufficient frequency, intensity, and duration to maintain or improve joint health and physical fitness. Doing specific types of exercises can reduce pain and improve balance and ability to move for people with osteoarthritis. To help you or your care recipient exercise properly and safely, your clinician should provide you with a therapeutic exercise program that is designed to meet the needs of you. Therapeutic exercises will help strengthen your muscles, train them to move in ways that reduce the load on the joints, and they should also include exercises to improve heart and lung fitness, which will give you more energy to do your activities. I mentioned earlier the Good Life for Osteoarthritis program, and based on the success of that program from Denmark, the GLAD Education Exercise Program for knee and hip is now being made available in Canada. The GLAD website offers exercises under the participants tabs and links to videos and shows you exercises. And again, I think we're going to be, I've noticed it's been shared in the chat. So have a look at their website, lots of really interesting information. Also, there's a tab there where you can access clinicians locally close to where you're living that have gone through the GLAD training. Quality Statement 6 is on physical activity. In addition to therapeutic exercise, a person with osteoarthritis should try to be physically active every day because regular physical activity can greatly reduce the pain, aching, and stiffness related to osteoarthritis and improve the person's overall health. Even a small amount of activity is good. If you or your care recipient feel pain while being active, it does not mean that the joint damage is occurring. If an activity does make symptoms worse, your clinician should show you how to modify it or recommend other activities. Try to do as much physical activity as you or your care recipient can tolerate. Even being active for 10 minutes at a time will give you health benefits. You can start small and gradually increase the amount of physical activity you do each day. If you'd like to learn more about physical activity and arthritis, you can watch a webinar that the Canadian Arthritis Patient Alliance held a few months ago, and you can find it on their website under the Managing Daily Life tab, and we'll be putting that link in the chat as well today. So moving on to Quality Statement 7, and it reads, people with osteoarthritis who are overweight or obese are offered patient-centered weight management strategies, and people at a normal weight are encouraged to maintain their weight. Being overweight can make joint pain and mobility worse. Losing weight can improve a person's osteoarthritis symptoms. If the person who has osteoarthritis, either you or your care recipient, is overweight, the person's clinician should offer to help them lose at least 5 to 10% of their body weight. If the person needs help losing weight, their primary care clinician should refer them to a weight management program or dietitian who can provide information and advice. Again, GLAD Canada offers virtual education sessions on managing nutrition and diet to fight inflammation and improve osteoarthritis symptoms. And you can find that under the Participants tab as well. Quality Statement 8, lastly, I want to highlight that this statement reads, people with symptomatic osteoarthritis are offered pain-relieving medication options when non-pharmacological treatments are insufficient to control their symptoms. So if things like exercise and weight management are not working well enough to control osteoarthritis symptoms for you, your primary care clinician should offer options for pain-relieving medication. Note, it's still important to continue the therapeutic exercises, physical activity, and weight management, even if you decide to use pain medication. One does not replace the other. The first medication your primary care clinician should offer is you can use creams to rub over the joint, such as Voltaren or Icy Hot or Bengay. Sometimes that will give you local relief. If this doesn't work, your clinician may recommend an over-the-counter pill like Tylenol or Advil, prescription pills, or an injection into the joint, such as a cortisone shot. Your primary care clinician should not offer you an opioid medication as the first line or routine treatment for osteoarthritis pain. These drugs have serious risks, including addiction, overdose, and death. Your primary clinician should review your medication use after a certain time. However, if you experience any side effects from the medication, tell your primary clinician right away. Again, the GLAD website, you can learn more about these different treatment options for mild, moderate, and severe osteoarthritis under the osteoarthritis tab. I'll hand it back to Anne-Marie now.
Thank you so much, Carol. That was very informative. And just wanted to remind folks that all the links that have been shared in the chat box, you will get all of those in the post-webinar email. So no need to frantically make notes if you're trying to pay attention to the presentation. So I would like to now turn it over to Carolyn, who will tell us more about how Arthritis Society Canada works to support these new standards.
Yes, thanks so much. I'm just really happy to be here on behalf of Arthritis Society Canada to build upon what Carol and Ash and Kathleen have been sharing, and how some of the resources we have hopefully can help fill some of those gaps in knowledge and that foundational education and self-management piece. So on the next slide, I'll just give a little brief overview of who we are in case you're not familiar with us. So Arthritis Society Canada is a nationwide health charity or nonprofit dedicated to the 6 million plus people living with arthritis today, those at risk, those caring for them, those who love them. It's quite a big number. So we fund research. We work with all levels of government for advocacy to give people living with arthritis a voice at those tables. We fund innovative solutions for life with arthritis. And what I'll talk to you about today is we produce a lot of information or education resources, and we have a number of support programs for people living with osteoarthritis or other forms of arthritis and rheumatic disease, as well as people who care for them. So on the next slide, since we're, a caregiving group audience here today, I wanted to highlight one online resource we have dedicated towards caregivers. You'll see short links here, which we'll share in the email after the webinar, and everything I share today is available in English and French. So this is an online resource designed as a self-directed e-learning module about caregiving, whether that's you as a caregiver with arthritis or caring for someone with arthritis. So you can go end to end, or you can pop into different topics, going all the way from an introduction to caregiving and arthritis if you're new to that, to some really useful information on relationships and the power dynamic and communication between carers and care recipients. So that's a great place to start. To take a look. And then on the next slide, I want to share some other online resources if you have access online. We've started over the last few years to really try to bring together content on different topics into what we call hubs, so that you can kind of have a one-stop shop on everything on our website about osteoarthritis, for example. So I wanted to pull out 4 of these hubs that may be of interest to you. The first is on osteoarthritis in general, so anything you could want to know about that, bringing all of our resources together at arthritis.ca/osteoarthritis. The next one is on physical activity. Oh, sorry, back to that first slide there. Yeah, the next one is on physical activity, which answers some of the questions that came up today. So what types of physical activity are good for me? What types of exercise? How do I keep going? What if I have pain? And we have a neat, searchable, filterable library of videos and articles on different types of exercises and physical activities that you can filter by the joint where you have osteoarthritis. You can also filter by type of activity like mind body work or endurance or strengthening, so that you can get some inspiration on some forms of physical activity that you'll find enjoyable and will help you manage, or the person you care for, help them manage their symptoms. The third one there is mental health, which I wanted to highlight. Again, speaking especially to the lived experience stories is so important to have resources to support your mental wellness. while living with chronic disease. We are taking a look at this section of our website and updating it throughout this year. So maybe take a look now, take a look in a few months, and hopefully you'll find something that speaks to you. And then finally, just getting back to the recommendation about sometimes needing medication, we have an online medication reference guide, which gives you some important information, basic information about over 40 different drugs that you might be prescribed or access over the counter for arthritis or osteoarthritis. So knowing more about the medications can help you have great questions to share with your healthcare team or your pharmacist or your doctor, for example. So then on the next slide, I wanted to just pick up on that physical activity piece. So in that physical activity hub, you would find a link to this video series we have here. Also, if you go to Arthritis Society Canada's YouTube channel, we have a series of exercise videos for osteoarthritis of the shoulder, hip, or knee. And these were developed by and are explained by physiotherapists, clinicians with specially trained in arthritis. So this is a great place to start to understand some of those exercises that are really tailored for you or for the person you're caring for who has osteoarthritis. Then on to the, I know I'm going quickly, so forgive me, but we have a lot of resources to share, and you'll get, again, links to these afterwards. If, however, you don't have access to the internet, you can still get a lot of information from us. We have an arthritis line, an arthritis telephone line with a 1-800 number shown on the left there, and you'll get that in the post-webinar email as well. So you can ask trained volunteers and staff members questions about arthritis. They can connect you to resources and more information, help you navigate the website if you need help, and also they can mail you some information as well. And in the chat, I see the mental health resource question. So it was arthritis.ca/mental health was the mental health hub. But those links we'll share at the in the post-webinar email as well. On the right, I did want to share, again, it's a digital program, but if you have access online, you can access some peer support and community support sessions. So this is a newer program from Arthritis Society Canada where you can book some time with volunteers who are speaking from their lived experience on topics like supporting someone with arthritis, talking specifically about osteoarthritis or other specific arthritis types, about chronic pain, about joint replacement surgery, and about staying active. So it's a nice little way to mix and match, maybe connecting with someone who's going through something like you or who has gone through something that you're going through. So then finally, on the next slide, I wanted to share if you have anything that you take away from this very brief highlight of our resources. For those of you living in Ontario and joining from Ontario, I wanted to share that we have a program funded by the government, run by Arthritis Society Canada, called the Arthritis Rehabilitation and Education Program. So this is actually free access for people of any age with a diagnosis of arthritis to services from occupational therapists, physiotherapists, or social workers. As long as you have an OHIP number, an Ontario Health number, you can access these services for free. So depending on where you live in the country, that could be individual consultations in person, by phone, or virtually. And there are also group education workshops offered virtually. The clinicians can consult and guide, especially on arthritis self-management and that foundational education piece, but also cover, physical supports, emotional and psychological supports as well. So this is a great resource to access. You can book a free appointment or get more information by phoning the 1-800 on this number on the screen now, and we'll email it out to you too. You can email AREP, A-R-E-P, at arthritis.ca, or you can visit us online at arthritis.ca/AREP, A-R-E-P. So I hope from that really quick overview, something speaks to you in terms of something that a resource that might support you or your loved one or your care recipient dealing with osteoarthritis and being able to improve, symptom management and quality of life. So thank you from Arthritis Society Canada.
And thank you so much, Carolyn, for that was a lot of information, but thankfully there's a lot of places where folks will be able to access this information again. And I want to thank everyone on the panel for sharing your experience and all the information with folks today. So we'll move on to questions. We have about 15 minutes left. There were a couple of questions submitted, and so I will start. Does anyone on the panel have advice for someone who's caring for a nonverbal teenager who has osteoarthritis in the hip?
I will say from Arthritis Society Canada, just in terms of the arthritis rehabilitation and education program, the AREP program I just mentioned, I did, while we were talking, just shoot a message to my colleague who oversees that program to ask whether any of the physios or occupational therapists have that experience specifically. We're going to have to look into it, but probably the best thing to do if you're interested in that type of program, accessing that type of support, would be to call or email us that contact information that's in the chat, and it'll come out in the email. And then the team will be able to answer whether that's something that clients that we've worked with before.
Great. That's great advice. Thank you. I know the standard doesn't address the hands or osteoarthritis in the hand and wrist, but is there any non-medication treatment, some exercises maybe that on the GLAD Canada resources for hands, for osteoarthritis in the hands?
I can just be, so GLAD, I believe is specific to hip and knee. So that program the quality standard does address knee, hip, hand, or shoulder. So all the statements would be applicable to people with arthritis in the hand. And I think probably the best resource would be through the Arthritis Society if they're looking for exercises. Carolyn, you might be able to speak more specifically, but I'm sure that would be included in some of those sites that Carolyn talked about.
Yeah, I think a lot of the research, most of the research that's been done is on bigger joints like the hip and the knee. But we do have certainly some information on our website if you go to that osteoarthritis hub. So arthritis.ca/osteoarthritis is the short link there. You'll find some information on the hand. If you search in our search bar or even Google like Arthritis Society and hand osteoarthritis, or go to our YouTube channel. We do have a short video as well, an arthritis advice video about arthritis in the hands as well. So certainly connect with us. If you have trouble finding the information on our website, feel free to reach out to us through our arthritis line or our email, and we can point you to the right links.
Great resource. I have a question for our two caregivers. So maybe we'll go one at a time. It's the same question, but maybe we start with Ash. Is there one thing that you learned from the presentation today that would have helped you if you could have learned it earlier in your care journey?
That is a good question. I think just the resources that were mentioned were copious, whereas the resources that I've received from in-person practitioners were very, very limited. So, there seems to be a disconnect, right? And it would be great to bridge that connection. Yeah, I like options when it comes to my care.
Yeah.
I don't like limited options. So I would have liked to see that from practitioners that I've dealt with in the past.
Oh, that's fair. What about you, Kathleen?
Well, the fact that there are standards of care at all was very interesting to me, because as I said, I didn't really receive any. And so I just thought I had to sort of stiff up my lip and endure until I could get to a knee replacement. age. So that's part of it, but I'm also intrigued, as is Ash, by these resources, particularly the Arthritis Rehabilitation and Education Program. Part of my problem is I don't have a GP at the moment. My old GP that originally diagnosed me, he's moved out of bus range, so I can't get to him. Then I had one locally, and that office closed during COVID. So I don't have a GP at the moment. So accessing any kind of services is really difficult. And I'm on ODSP, so I'm hoping that some of these resources you've indicated are going to be free so that I can access them and hopefully improve my situation and that of my wife.
Yeah. Information is key as long as it's timely, right? Okay, so we have some other questions coming in the chat. How does one slow down the progression of osteoarthritis? Is it just motion is lotion, or is a more personalized care plan necessary? And is there anything good to know that might hurt a person with osteoarthritis if it's not understood properly?
Yeah, I can start and then Carolyn, if you want to add, but I think what's really key is sort of a very like the statements we highlighted around, you know, education. So knowing what's good and what's like what you should do and shouldn't do, having a self-management plan, a specific therapeutic exercise program that's targeted to your specific needs. So and tailored to the specific person. So you're doing the right exercises, so you're not injuring yourself and causing more pain. And again, just regular physical activity is so important to, you know, minimize sedentary and just walking or moving or doing some sort of physical activity daily is really key. And then weight management as well, so less stress on the joints. So there are lots of, most of the standard is, you know, things that you do like before you even consider going for a consultation for joint replacement surgery. There's lots to do. And Carolyn, you may have additional things.
Yeah, no, I was also going to suggest, yeah, like even within the physical activity realm, like working with educational materials or clinicians like the AREP program who can personalize that for you and for the type of joint pain you're experiencing, I think would be very beneficial. They can also advise on, you know, what type of exercise induced pain might be, you know, general soreness and what might be getting into that realm of where you should be avoiding it. So I think that is great information as well. There was another question about nutrition and, you know, does what I eat impact my symptoms? And that all feeds into weight management as well. That's another area of our website that we're actively updating and reviewing this year. But certainly we have a lot of kind of recipes and another e-learning module on eating well that can just support overall healthy living, which is kind of foundational to managing any chronic disease as well.
Right. We talked about surgery, and you know, we heard from Kathleen that she's kind of impatiently waiting until she's in that proper window. Any suggestions on what folks can do while they're waiting for surgery, whether it's been scheduled and they're waiting, or they're waiting to even get to that stage, that might help them manage?
Yeah, excuse me, can I just
Oh,
respond
yes,
to the
Kathleen,
previous
sorry.
question about nutrition?
Mhm.
I found that for me, it may not be your case, but for me, I'm not a healthcare professional or nutritionist or anything, but in my case, food choices has a huge impact on my overall wellness, my alertness, my mobility, everything. And about a year ago, I transitioned from regular eating to being vegan, and I lost 15 pounds very quickly, and my inflammation has gone down so that I almost never need pain meds anymore. So for me, it has made a huge difference to look at what foods will trigger me and making different choices that support me overall.
Healthy nutrition is never a bad idea. But it's great to hear that it's had such a noticeable impact, eh? That's great. Thank you for sharing that.
And like having a food diary or something like that also helps
Yeah.
you figure out if something is making you personally flare. Um, uh, and that actually brings me to giving a little plug for another one of our resources. So Anne Marie was asking about, when you're waiting for surgery, what can you do in the meantime, to even improve your recovery after surgery, or to manage your symptoms while you're waiting. And we actually have a webinar series as well at Arthritis Society Canada called Arthritis Talks, which I'll type the link into the chat afterwards. But we actually have on Wednesday, June 25th, coming up a webinar conveniently that addresses that exact question. So what to do, what can you do while you're waiting for surgery? So I'd encourage you to check that out, register for that. All of those are recorded similar to OCO's webinars and posted on our website. So we do also have webinars from dietitians. Actually, a dietitian will be on the waiting for surgery panel as well. But we have past webinars on gluten and arthritis, anti-inflammatory eating and arthritis, what's the evidence, and what is maybe just generally good, healthy living advice. So I will just type in the chat how to find those recordings.
Great, thank you very much. And just, reminding everybody that, of course, our webinar here today is only for informational purposes. So please, speak with your care providers and professionals before you make any changes in your own treatment and choices. But as I said, never hurts to hear from other people's experiences. Thank you, Ash and Kathleen, for sharing your experience as folks living with osteoarthritis, and also to Carol and Carolyn for sharing more about the Ontario Health Quality Standards on osteoarthritis of the knee, hip, hand, or shoulder, and strategies to support someone with this condition. There's so many wonderful resources that our audience can review, and tips that people can implement in their own caregiving journey. So thank you so much for joining us today.